So in this video we are going to talk about dizziness and vertigo originating from either from the cervical spine, or you can differentiate either it is from the semicircular canal or either it is from the vestibular nuclei. So there are so many tests to differentiate all of this. So first test is for the dizziness test. So before we go for all this, let me tell you what's the difference between dizziness and vertigo. So vertigo is a patient feels like a sensation of moving. Either patient feels like if I'm moving or surroundings of patient is moving. Dizziness is more or less compared to the lightheadedness, where patient feel like, oh, I'm going to drop. So first test, we'll start with the dizziness test. So this test should be performed in two steps. So first step, you make the examiner make the patient sit in a circular table. That circular table rotates itself, so you can move the patient, right? So in the first step, examiner actively rotates the patient head to the extremes of rotation and hold that rotated position for about 10 to 30 seconds. And check that if there's any dizziness or lightheadedness. In the second part, examiner holds the patient's head and rotates the shoulder extremely to the left and right and hold that position for 10 to 30 seconds and check for any dizziness or not. In both of these cases, you can come to and conclude that vertebral artery is somewhere compressed or kinked around. So that means the dizziness is originating from vertebral artery. Now we'll move to the semicircular canals. So semicircular canal is a structure in the inner ear. Now, so if there is dizziness only in case of head rotation or cervical rotation, there can be a chances that the dizziness is coming from a semicircular canal. Now, Fitz and Ritson, according to Fitz and Ritson, they advocated that this test should be performed in two steps. In the first step, you rotate the head of the head of the patient with the eyes closed. And if the patient tells any dizziness in the first stage itself, that means there is a problem in the vestibular nuclei. So vestibular nuclei is situated somewhere in pons, midbrain and medulla oblongata. Vestibular nuclei is responsible for maintaining equilibrium, balance, head position in a neutral cervical position, and maintaining a clear vision when a patient actively rotates the head. So if you rotate the head, that means your vision should be clear. So these all four vestibular nuclei is responsible. So according to Fitz and Ritson, if the patient experiences any problem in the first stage when the eyes are closed and the head is rotated, that means there is a problem in a vestibular nuclei. So in the second stage, it's the same, but this time the eyes are open. So according to Fitz and Ritson, this time if the eyes are open, that means the problem is somewhere in the cervical spine, maybe the VBI or vestibular artery. Now we'll move to a third test that is called as a Hallpike-Dix test, or you can say as a Dix-Hallpike test. This test is mainly performed to check BPPV, benign paroxysmal positional vertigo. In that, patient is in a long sitting position and the head is rotated to one side 30 to 45 degrees. Always check the unaffected side first and then come to the affected side. So examiner rotates the head about 30 to 45 degrees, hold that position. So one hand of the examiner will rotate the head and other hand of the examiner supports the trunk. Then suddenly make the patient in a supine lying position, but head is little down than the horizontal level, little below the horizontal level, and hold that position for 30 to 60 seconds. If any nystagmus is observed in eyes, that means the problem is in the canals and that patient is positive for benign paroxysmal positional vertigo. Last is the temperature test or the caloric test. In that, examiner alternatively applies the hot and cold test tubes just behind the patient's ear. If dizziness or lightheadedness is observed, that means it's the vertigo is indicated. That means the patient has problem in the inner ear. Thank you.